My patient is Mr. Hatch, and he is a type 2 diabetic. He came in last week with a wound on his foot, and it got infected. He has peripheral neuropathy and didn't know he hurt his foot. The wound care team put him on antibiotics, irrigated and medicated his wound with topical ointment, and wrapped it. He has been on med-surg unit for the past week, and the nurses have been tending to his wound daily. His wound is 90% healed, and he is getting ready for discharge. The patient would not like to be on camera because of his infections. So, coming into his room. Hi, Mr. Hatch. My name is Amanda, and I'm a registered nurse, and part of my job is to help people with care instructions once they leave the hospital. Just to make sure I'm in the right place, could you give me your full name and your date of birth?
It's Roger Hatch. My birth date is 10/1/56.
Perfect. So I understand you're going home today.
That's what they said.
Okay, great. Well, I'm working with your nurse, Oscar, so we can get you discharged as soon as we can. Oscar informed me about your diabetes and the wound that is healing on the bottom of your foot. I first want to talk to you about your diabetes. How long have you had type 2 diabetes?
I found out about 10 years ago.
Okay, so what it says in your chart is that you've been trying to manage your diet and have been taking your medications regularly, so that's really good. Your blood sugar has been right where it should be while you've been here at the hospital. When you test your blood sugar at home, where does it usually register?
Most of the time between 100 and 150. There's been a few times it's dropped too low, and I drank some apple juice, and then I was fine.
Oh, well, that's great. It's good to hear. I'm glad you know how to do that. It's very important to keep your blood sugar regulated. So you said it dropped too low. Has your blood sugar ever gone too high, like over 200?
Yes, it has.
It has. Okay, so what did you do to lower it?
I gave myself an insulin shot when that happened. My doctor gave me a sliding scale so I know how much insulin I have to have. That doesn't happen very often, though.
Okay, well, it sounds like your doctor has given you great instructions and has stayed on top of your diabetes. So as a nurse, though, I would like to remind you, in order to keep your diabetes in check, keep eating the diet that you have been, because it sounds like you cut out a lot of foods that made your blood sugar go out of whack, and continue taking your medication, and then check your blood sugar daily. So how many times a day do you check your blood sugar?
Usually before breakfast and then before dinner.
Okay, well, that's really good to hear. I'm glad you know how to do things to help your blood sugar when it goes too high or goes too low. That is very important and great news.
Thank you.
So now I'd like to switch gears and talk about the wound on your foot. So Oscar informed me that you don't know how you got the wound, but last week you took off your sock and there was some sort of liquid on it. Could you describe that liquid?
Yes, it was a yellowish like red in the middle. I found out when I came to the hospital that it was blood on the sore was infected, and the yellow, that's what the yellow stuff was.
Okay, so the yellow was from your infection. Okay, so that sounds pretty painful. It didn't hurt?
No, I can't really feel my feet very much anymore.
So you can't feel your feet, so are there any other feelings you have in your legs or your feet? Like, do you have any tingling or shooting pains, anything like that?
Yes, at first my feet were tingling, and then they felt like they were always falling asleep, and sometimes I'd get shooting pains by my ankles. Now I just don't have any feeling at all. Mostly in my right foot, that's where the sore is.
Okay, yes, I understand what you are describing. And so Oscar said that this was the first sore you got on your foot. How often do you check your feet for like cracks and sores and scratches or anything like that?
I look at them when I wash them, but I can't see the bottom of my feet.
Well, that is difficult to do, I'm sure. It is important that you check your feet every day, though. You could use a mirror to look at the bottom if you have a hard time seeing underneath them. Do you live alone, or do you live with anyone?
I live with my wife.
Your wife, okay. Well, maybe she could help looking at your feet. If you don't have a mirror, you could use. Once a day, maybe after you shower, before you go to bed, try to make it a habit of looking at your feet and in between each toe as well.
Why is it important to do it so often?
Well, that is actually a very good question. So unfortunately, diabetes can affect many parts of the body, and the legs and the feet are some of those parts. People who have elevated blood sugar over time for many years, such as you, can have little or no ability to feel pain in their feet due to nerve damage. because of those high blood sugar levels. So what happens is, not enough blood can pump down to your lower part of your body, and this can cause loss of feeling. So with your case, you hurt your foot at some point in time, and that sore got infected because you were not aware that it was there because you could not feel it. Because you have diabetes, which makes your blood sugar do funny things, your body also has a hard time healing when you do have a sore, especially when it gets infected. So that is why you should check your feet every day, because you want to make sure you don't have another sore, since you don't have any feeling in your feet, to let you know that there is one. So I know I just threw a lot of information out at you. So just so I know I explained myself clearly to you, could you explain it back to me to make sure that I did?
Well, I'll do my best. I have diabetes, and that can make it so my blood doesn't flow everywhere it's supposed to the right way.
Right?
My feet have lost feeling because the nerves don't work right and the blood doesn't get to them the way it's supposed to. That's why I can't feel the sore on my foot, and I got infected because I didn't know it was there. So I need to have my wife check my feet before I go to bed every night to make sure there isn't any new sores.
That is correct. Very, very good. So the medical staff has done a great job with your wound. I had a peek at the pictures when they were changing your dressing an hour ago, and it looks much better.
That's good to hear.
Yes, and I am sure Oscar is going to explain what to do to take care of your sore once you get home, but I'd like to add some information as well. Along with checking your feet daily, there are some other tips I would like to add to avoid having more sores on your feet. So I'm going to give you a couple of brochures, and it's going to explain all of this information, and I'll put it in your discharge packet, but because I do know that it's a lot to remember.
Oh, good. I can let my wife read it.
Yeah, that's good. That is a great idea, since she will be helping you. So first thing I really want to point out is it's very, very important to keep your feet clean, and when you do wash them, use warm water and mild soap. Make sure you dry them really well, especially between your toes, because too much moisture can cause cracking, and over time that will cause sores and then possibly another infection. Also, changing your socks daily is very important as well. When your feet sweat, it can cause too much moisture, and it can irritate your skin and then cause sores. And I'm not sure what shoes you wear because you don't have any on right now, but it would be a good idea to find shoes that are comfortable and support your feet. Sometimes if shoes don't fit properly, they can rub funny and then cause sores. And then another very important thing to remember is never walk barefoot. There are things you could step on that could cut your feet and cause a sore, and also the ground is really dirty. And if you remember, I said you always want to keep your feet clean to avoid any type of germs getting into your skin. So again, I know that was a lot of information, but let's pretend your wife is here and you need to explain these tips to her. Could you please teach your wife the tips that I just told you?
Okay, so I need to always keep my feet clean and dry them well so I don't get any sores on my feet. I need to change my socks every day because my feet sweat and I don't want to get my feet too wet. I should always wear comfortable shoes and never walk barefooted because I don't ever want to come back to this hospital because I got another sore that got infected.
Yes, excellent, and I can understand that, Mr. Hatch. So the last thing that I want to suggest to you is to make an appointment with a foot doctor, which is called a podiatrist. I have a card here for one that is local, and I do suggest that you go see him. So one very important thing that he will do, besides making sure that your feet are in good health, is he can cut your toenails. So I know you know how to cut your toenails, but because you have no feeling in your feet, you could possibly cut your nails too short, and that could cause an infection. We don't want that to happen.
Okay, I can do that. I'll give the card to my wife and she can call and make the appointment.
That is a wonderful idea. Thank you, Mr. Hatch, for taking the time to speak with me, and best of luck to you.
Thank you.